The first-line therapy for patients with FLT3 mutant AML is generally midostaurin in combination with intensive chemotherapy. Another FLT3 inhibitor is called Sorafenib, and that's quite also available around the world, mainly for people with renal and hepatocellular carcinoma. Because it is a FLT3 inhibitor as well, we did a randomized trial within the Australasian Leukemia and Lymphoma group. And in this trial, we randomized patients with FLT3-ITD mutant AML with an allelic ratio of at least 0.05. Patients were eligible if they were aged 18 to 65 years. And patients were given Sorafenib at a dose of 400 milligrams twice a day between days 4 and 10 of induction as well as consolidation therapy. Patients were also entitled to have up to 12 months of maintenance therapy. The randomization was 2-to-1 in terms of ratio to Sorafenib or to placebo. The primary endpoint of this study was event-free survival, with the events defined as patients not achieving remission, secondly, patients relapsing, and third, patients dying from any cause. In terms of the primary overall endpoint at 2 years, there was in fact no difference in event-free survival in the Sorafenib versus the placebo arm. Furthermore, there was no significant difference in overall survival between the two arms. The response rate was actually very high in both the FLT3 inhibitor and the placebo arms, with the response rate being 91% in the Sorafenib arm and 94% in the placebo arm. The stem cell transplant rate was also high in both arms at approximately 60%. In some exploratory analyses, we found that in patients that achieved a complete remission, overall survival was superior for patients receiving Sorafenib. And also there was a trend for improved survival for patients receiving Sorafenib if they had a higher allelic burden with the cutoff at 0.7. Furthermore, patients who received Sorafenib had, as expected, an increased rate of palmar-plantar skin reactions at a rate of 15% versus 6% for those receiving placebo. So in conclusion, this was a phase 2 study. It was not powered for overall survival, and our major finding was that there was no significant improvement in event-free survival, but there were improvements in overall survival in exploratory analyses in patients that achieved a CR with Sorafenib, and also patients that had a higher FLT3-ITD allelic burden.